Oral questions by members.
Member for Surrey White Rock.
Thank you, Mr. Speaker. Deficit and debt levels have reached an all-time high. In fact, every single minute that passes by is $13,000 to pay on interest. During this question period alone, half an hour, that's $400,000. Now, the Premier gets up and he talks about families in British Columbia and how they're going to experience the economic hardships with these tariffs. But what he doesn't talk about is the fact that he has got an absolute double standard. Because at a time when he's saying British Columbian families are going to have to go without, whether it's the election promises he's made, what does he do? He increases his office. So, on one hand, we are telling Surrey School District they are going to have to cut buses for children with disabilities. Okay? They are going to have to cut and close learning centers. At a time like this, they're going to have to cut band programs. But for him, it's the most opportune time to increase the size of his office. How does this Premier get up and defend himself to the children of Surrey that are having to go without at a time when he increases his office?
Mr. Premier.
Thank you. Surrey has been a fast-growing community, Honourable Speaker, for many years. That was the case when the leader of the opposition sat on this side of the House. And they had choices to make then, and we had choices to make. When they were on this side of the House, they had the opportunity to do a new medical school in Surrey to head off the crisis around the shortage of medical workers in our province. They chose, it was a choice, not to do it. They had a chance to build the new hospital in Surrey. They had a choice. They chose to sell the land to a donor at below market value. Honourable Speaker, we're making different choices for Surrey. New hospital, new cancer centre for Surrey, new medical school for Surrey.
Member.
SkyTrain expansion in Surrey. Thousands of new student spaces in Surrey at new schools. The Snoqualmie Elementary construction underway, 655 seats in that one alone. 500 new seats for an expansion at Quantland Park Secondary. These are necessary investments for a growing community, and we are proud of them, Honourable Speaker.
Surrey White Rock supplemental.
Thank you, Mr. Speaker. And the irony of that answer is that there seems to be a shortage of NDP MLAs from Surrey to applaud that. And I think we saw that tenfold in October. And listen, the Premier gets up and he talks about choices. And he's right, the choices that he's making. Let's talk about the choices this Premier has made. This Premier has made the choice at a time when people are having to go without, at a time when he is absolutely going back on his word on the campaign promises that he's made. He is making a choice to increase his office. He is making a choice to close learning centers. He is making a choice to tell the children of Surrey with disabilities that we cannot afford buses for them. He is making a choice to tell kids that are wanting to get into the band programs, we don't have the money to make. He is making the choice at that time to hire communications officials for these ministers. Those are his choices, and I think they're the wrong choices.
Shame on you.
So again, the Premier has maxed out the government credit card here, but he finds it the opportune time to cut from the Ministry of Environment and to increase the Premier's office. How does the Premier justify these decisions to increase his office when he is telling British Columbians that they need to tighten up their own budgets?
Mr. Premier.
Thank you, Honourable Speaker. The member knows what he's saying about the budget is simply not true, Honourable Speaker. Over $1 billion.
Members.
Members,
are you interested in listening to the answer, please?
Over over $1 billion in the capital budget for the City of Surrey for new schools. Now, remember to know that the Leader of the Opposition that he sits with, that when they were on this side of the House, they closed 256 schools, Honourable Speaker. That's the record. That's years ago, says the Leader of the Opposition. Yeah, it's been a while, member, that's right. But the thing about the truth is, it's important to stand up for it. And I want to take a moment to recognize the people who stand for truth, the people who stand with integrity for what is true and honest, deserve to be recognized on the other side of the House. And I want to recognize the House Leader of the official opposition for standing with integrity, for truth, for residential school survivors. I know it's not easy, and she's doing, am I going to politicize this? Honourable Speaker, there is a member of this House who has gone on a podcast to call out the House Leader of the Opposition for standing up for residential school survivors. I'm not politicizing what should never be politicized.
Member.
There have been some despicable things that have happened, Honourable Speaker. They deserve to be called out, and the House Leader is right to do so.
Member for Skeena.
Thank you, Mr. Speaker. This government has mismanaged BC's economy so badly that it is spending more on debt interest than critical mental health services. The amount of debt servicing in 1 year is $7 billion. That could fund 20,000 treatment and recovery beds. When will this government understand that detox, treatment, recovery, and wraparound support are essential in the fight against the overdose crisis?
Minister of Health.
Thank you so much, Honourable Speaker, and I really appreciate the question from the member and the fact that she's the critic for mental health and addictions, because it's so important that we as members in this House continue to work together to increase the amount of supports available for people, especially at this time when toxic drugs are killing people. Mr. Speaker, it's incumbent on us to do everything we can, and that's why this government has prioritized and will continue to prioritize expanding the continuum of mental health, substance use supports. Mr. Speaker, since 2017, we've invested millions and millions of dollars into mental health and substance use supports, $184 million alone to increase the injectable opioid agonist treatment services and tablet IOAT, $176 million to increase youth substance beds, Mr. Speaker, $138 million for opioid use disorder treatment, $88 million to fund recovery beds through year-end grants. Mr. Speaker, millions of dollars are going into this, but it's not enough. We've got to do more, and that's why we're going to stay focused on this, and we're going to continue to take every step that we can to bring down the number of lives that have been lost and the impact that all British Columbians and communities are feeling.
Member for Skeena supplemental.
Thank you, Mr. Speaker. Respectfully, we still don't have any new beds getting built this year, though, and that's what we need. For $7 billion in debt servicing, this government could instead fund enough treatment and recovery beds to begin healing British Columbians suffering from mental health disorders and addictions. This government clearly doesn't believe in treatment because they couldn't even follow through on their campaign promise to fund a second Redfish Healing Centre. How can this Premier look British Columbians in the eye and say he cares about the lives of people who are dying every day and not commit to a real recovery plan for BC? We need beds built.
Minister.
Thank you again, Honourable Speaker. We have added hundreds of new beds to the thousands that already exist, Honourable Speaker. I appreciate that the member opposite is mentioning the cost of debt servicing. And I want to point out that when the opposition leader was in cabinet a decade ago, the percentage of budget that was going to debt servicing costs, Honourable Speaker, was higher than it is today. We are taking steps.
Member.
Honourable Speaker,
Member.
we are taking steps to continue to invest in mental health and substance use, to continue to add treatment beds for youth, for Indigenous peoples, for groups of people that need this treatment and recovery. We're going to continue these investments, and we're not going to stop.
House Leader of the Third Party.
Thank you, Mr. Speaker. The Critical Response Unit, or CRU, formerly called the Community Industry Response Group, is a lesser-known unit of the RCMP that operates largely in secret, brutally silencing land defenders on behalf of resource extraction companies. It's estimated that the government has spent at least $86 million on CRU since its formation in 2017. That's $86 million to harass, survey, intimidate, and criminalize protesters, land defenders, and Indigenous community members. This government's use of a police force to protect pipelines and logging projects and suppress free speech represents a profound failure to deal effectively with the climate emergency and to protect Indigenous rights. My question is to the Premier, why is he continuing to fund the pipeline and logging police during a climate emergency?
Minister of Public Safety and Solicitor General.
Thank you, Mr. Speaker, and thank you to the member opposite for the question. The characterization of the CRU unit by the member opposite misleads the true intent of the group. It is designed by police, for police, to deal with the issues that surround the pipeline in northern British Columbia. Any characterization that they're anything different is wrong. They do things as they've always done things, with fairness to all involved.
Member supplemental.
This year's budget forecasts natural gas royalties nearly doubling over the next 2 years. Yet numerous reports have warned that BC's nascent LNG industry carries significant economic risks for private and public sector proponents. BC's LNG industry will ramp up just as global LNG production is expected to plateau, making it a late entrant to a market dominated by established incumbents with better opportunities for economies of scale. It's a risky time to double down on further natural gas and LNG expansion, as long-term fiscal revenue streams are far from guaranteed. My question is to the Premier. Why does his government continue to invest in fracking and LNG when the economic forecasts paint a very uncertain future?
Minister of Energy.
Well, thank you very much, Honourable Speaker. Thanks to the member for his question. British Columbia, since 2017, has taken a consistent approach to addressing LNG in BC. We focused on a guarantee of fair return for BC's natural resources, guarantees of jobs and training opportunities for British Columbians, respect and make partners of First Nations, and I think everyone acknowledged that that is happening, and protect BC's air, land and water while living up to our climate change goals, in addition to supporting BC communities. Now, that policy has been put in place over that period and has had, I think, some significant successes, including the lowest emission LNG in the world. And that's something that British Columbians can be proud of. We're going to continue to take the same thoughtful approach over the coming years that we've taken in the past years. And I believe, Honourable Speaker, that will continue to be successful for all of our goals as a society, economic and otherwise.
Member for Courtenay Comox.
Mr. Speaker, in the next 21 minutes, slightly more time is left on the clock in today's ritual bloodletting, this government will spend over $275,000, nearly the equivalent of an ER physician's annual salary, just on debt interest. Meanwhile, rural ERs are shutting down due to a lack of doctors and nurses. If they can waste billions on interest, why can't they manage to keep ERs open for rural British Columbians who desperately need them?
Minister of Health.
Thank you so much, Honourable Speaker. Every time an emergency room needs to be closed temporarily because of staff shortages, it is really challenging for communities. And I appreciate that. I think every member in this House appreciates that, which is why we have to continue to do everything we can to attract new healthcare workers, to retain healthcare workers, to help fill those gaps, to help provide housing, childcare, all of the things that healthcare workers need when they're living in remote communities. Mr. Speaker, any interruption in services is stressful for people, but this is not a phenomenon that BC is experiencing alone. This is an experience that we are seeing across Canada. We are taking steps to attract new family physicians to help build up the primary care system and reduce the burden on emergency rooms, to provide bonuses for people who are working up north, filling in critical healthcare worker gaps in remote communities. Mr. Speaker, there's more work to do, but we are making progress. And emergency room closures have come down 40% in the last 6 months compared to the 6 months before. That's the right direction, but there's more to do, and we're going to continue it.
Member for Abbotsford South.
Thank you very much, Mr. Speaker. This government talks about helping Ukrainian refugees. Alex is a constituent of mine who was a medical doctor for 17 years in the Ukraine before escaping to British Columbia. Alex is fluent in English, and he would like to take the medical exam so he can practice here in BC, but the costs are prohibitive. He wants to give back. Will the Premier commit to waiving the exam costs for Alex to become a much-needed medical doctor, or does he think that increasing the funding for his spin doctors is more important?
Premier.
Thank you, Honourable Speaker. I would love for Alex to be a doctor in BC, and I'm happy to work with the member to see whatever we can do to get him off the sidelines and into our hospitals. And I think the member's context of this being an individual from Ukraine, and I want to thank the member for standing up for one Ukrainian, but I hope that the members on the other side of the House stand up for all Ukrainians. Yesterday, we had an abhorrent moment in this House where the member for Surrey Panorama mistook a traitor and a man who attacked President.
Member.
It's a simple question, Mr. Speaker.
Question has been already asked. Member, question was asked very clearly.
A man who called President Zelensky,
Yes.
quote,
Premier
the
is
freaking
giving the
Ukrainian
answer.
grifter, unquote. And then tweeted cheering on President Trump's attack on President Zelensky, saying, quote, America's back, baby. Zelensky gets put in his effing place. Honourable Speaker, that man who said those things was welcomed by that member as a patriot, Honourable Speaker. So this is the chance for the opposition to stand up, for the leader of the opposition to stand up and say that he doesn't think this man's a patriot, he doesn't think this man is an example, and he doesn't think this man should be applauded in this legislative assembly, Honourable Speaker.
Member for Abbotsford Mission.
Mr. Speaker, this government has mismanaged BC's business, resources, tax dollars of hard-working British Columbians. This health ministry has been sending cancer patients to the United States for treatment. That's $35 million spent on U.S. healthcare. That's 42 hours of this government's debt servicing payments that does not go towards essential services for BC cancer patients. Mr. Speaker, why does this government continue to fund U.S.-style health for British Columbians?
Minister of Health.
Thank you, Honourable Speaker. Thank you to the member for the question. I mean, we're taking incredible action to improve cancer care here in British Columbia, but people shouldn't have to wait. And that's why we made this option available for people, taking action now so that people can get the cancer care that they need while we build out our cancer care system here in British Columbia. Mr. Speaker, it's always known, everybody's known, this was meant to be a temporary and exceptional measure to be able to allow people to access that care in the U.S., Mr. Speaker. But our focus has remained on building out here. And Mr. Speaker, it is working. We have steadily improved access to radiation therapy here in British Columbia. We've recruited more oncologists, more radiation therapists. We're investing in projects to deliver radiation therapy. And Mr. Speaker, almost 90% of the patients who are starting radiation treatment are doing so within 4 weeks. And that's an 11% improvement over the past year. We're going to continue this work. We don't want patients to have to go to Bellingham, but we're not going to deny them the care that they need. We're not going to bring in U.S.-style two-tier system like we know the Leader of the Opposition has spoken about. We've heard. We're not going there.
Member for West Vancouver, Capilano.
Thank you, Mr. Speaker. This incompetent government has mismanaged this economy so badly. Instead of spending $18 billion on debt servicing, we could have doubled the budget for the Ministry of Education and Childcare to hire more teachers, EAs, counselors, psychologists. School boards are struggling with finite resources, deferred maintenance costs, and mushrooming portables. They grow overnight. Mr. Speaker, why are our children paying the price for this government's fiscal mismanagement disaster?
Minister of Education.
Thank you, Honourable Speaker, and I want to thank the member for the question because all of us here in this House want to make sure that our kids have all the tools and support they need to thrive in schools. Our government has been investing in education since the beginning. The very first thing we did when we formed government was put an extra $1 billion into the education system. And we've had record increases year after year after year since. We are continuing to invest in education and will continue to do so. But, Honourable Speaker, I have to wonder where we would be today if we hadn't closed 256 schools under the Leader of the Opposition's time in government. I have to ask myself, where would we be if we hadn't sold off 21 properties in Surrey that could have been used for schools? Budget puts an additional $371 million in education to continue our investments into teachers, into education assistants, into the supports that kids need, because we value education.
Member for Langley Abbotsford.
Mr. Speaker, this government has driven British Columbians deeper into debt and robbed us of our ability to pay for things British Columbians urgently need. Insiders have said that BC Ferries is facing a $500 million deficit. Mr. Speaker, my question through you, why is this government prioritizing interest payments to bankers instead of ensuring quality BC Ferry services, which is an extension of our highways?
Minister of Transportation.
Thank you, Honourable Speaker, and I thank the member for the question. This government is spending more than $15 billion on capital infrastructure to improve our transportation systems in our province over the next 3 years, Honourable Speaker. This government has worked to ensure that BC Ferries has the most affordable rates by providing $500 million to assist them in terms of keeping ferry rates low for individuals, Honourable Speaker. And we're going to continue working with ferries to ensure that they maintain the best ferry system in all of North America and indeed the world, Honourable Speaker. Those are the choices that we make, Honourable Speaker, looking out for British Columbians every single day, whether it's transportation, education, healthcare. But what are the
Member.
opposition's choices, Honourable Speaker? Well, the Leader of the Opposition chooses to have a campaign director who wears a MAGA hat. He chooses to have a party president who goes to Trump's inauguration. He allows members on his side of the House, when the opportunity is to condemn Trump and his tariffs, they refuse to do so, Honourable Speaker. And worst of all, Honourable Speaker, they welcome into this House and call a patriot someone who praises Trump's tariffs, his efforts to undermine our economy, his efforts to undermine union workers right throughout this province, Honourable Speaker. The person they introduced and welcomed so proudly is not a patriot, he's a traitor and a quit.
Thank you. Member for West... Member.
Ask a supplemental. I dare you.
Member, Minister, both sides, come to order. Member for West Kelowna Peachland.
Thank you, Mr. Speaker. This government has mismanaged the economy so badly. Debt interest payments are so high, it could have paid the salaries of 60,000 RCMP officers. That's 3 times the size of the entire RCMP force currently posted across Canada. Why did this Premier prioritize growing the debt instead of funding the police?
Solicitor General.
Mr. Speaker, and thank you to the member opposite for the question. This is a government that has increased policing in British Columbia. Over the next 3 years, 250 new police officers will be welcomed around the province. What we've been doing is concentrating on increasing the policing in British Columbia, and we will proudly continue to do so.
Member for Langley Walnut Grove.
Long-term care users are feeling left out by this government. They couldn't even maintain their commitment to provide 300 long-term care beds for Langley. 37% of Langley's population is over 65, which is higher than the provincial average. And yet, 3% of the interest on the debt could have had this facility built. Why are BC seniors so frequently left behind by this government?
Minister of Health.
Thank you so much, Honourable Speaker. It's so important to make sure that seniors have the quality of life that they deserve. Indeed, they are the very people who built this province. And that's why this government continues to invest in seniors' care and in long-term care, adding more than 5,400 new and replacement beds at 33 long-term care facilities. Honourable Speaker, hiring more home care workers, expanding programs so that seniors can stay in their homes, because we know that leads to healthier outcomes, better lives for everybody. But, Mr. Speaker, we don't have to imagine what life might be like under the opposition and what they would do for seniors, because when the Leader of the Opposition was on this side of the House, Mr. Speaker, he passed laws that devastated long-term care and led to the layoff of 10,000 workers. Mr. Speaker, he left 9 out of 10 care homes not meeting government standards. Mr. Speaker, we're taking a different approach. We're investing in seniors. We're going to continue to do that work.
Member.
And we're not going to stop, Mr. Speaker. Thank you.
Member for Kamloops Centre.
Thank you, Mr. Speaker. Well, this has been quite the question period of bluster from certain members on the other side, but total evasion of questions. And it's interesting when you always know the government's in a bit of trouble when they start falling back to the year 2001 and things that happened in 2002, because that's relevant to the fact that they've been government for 8 years. We had a health minister answer a question about patients going to the United States by saying this government will not be adopting two-tier U.S. health care on a question about sending people to a private U.S. hospital, Mr. Speaker. You have the transportation minister touting their $15 billion in capital spending in this budget, I'd point out that the projects in the capital budget for this government are currently $15 billion over budget. Of course they needed to add $15 billion to the budget. They seem to not understand that there's a finite number of dollars to work with in British Columbia. Surrey SkyTrain, $1.9 billion over budget and a year behind. Richmond Hospital, $1 billion over budget, 2 years behind. Surrey Hospital, $1.2 billion over budget and a year behind. Pataula Bridge replacement, $260 million over budget and 2 years behind. Broadway Subway, $127 million. 2 years behind. That's $4.5 billion of overruns right there, Mr. Speaker, and multiple years of delay. This government clearly cannot manage the finances of British Columbia. So again, why is this Premier, in the light of all of this fiscal mismanagement, prioritizing and actually protecting the hiring of political spin doctors and staff over the better finances for the rest of everyone else in British Columbia?
Members, these desks cost lots of money. Be nice to the desks. Thank you. Premier.
Thank you, Honourable Speaker. Let me begin first by thanking the member that asked the question for standing up for residential school survivors. I know it's not easy, but he stands with integrity, and I respect that. We don't always agree. Well, we don't agree generally. But on that point, we do. Honourable Speaker, costs are up. Absolutely. Families doing renovations, contractors wanting to build housing, businesses wanting to expand. They're seeing the impacts of global inflation, higher interest rates. Government's not immune from that. And so when we see these costs go up, we do have a choice. We're going to build all of the things the member listed: hospitals, rapid transit, schools, critical infrastructure to grow our economy, or do we abandon those projects? And the choice is obvious, Honourable Speaker. We have to build these things. We have to build our province. In this moment, more than ever, we have to make sure we can stand on our own 2 feet, train our people, treat our people, support our people, grow our economy. And that's what we're doing, Honourable Speaker. I am proud that last year we had the fastest growing economy in the entire country. And I'm proud of the 10,300 jobs that the private sector added just in January, Honourable Speaker. But we are on the abyss of the gravest economic threat this country has faced in generations. And we are going to support British Columbians. We have the second lowest debt to GDP ratio in the entire country. We have the space to do it, Honourable Speaker. We have the people. We have the geographic positioning. We have the resources, Honourable Speaker, and we have the government that is unquestioningly supporting British Columbians and Canadians every step of the way. We don't mistake racism for the truth, and we don't mistake traitors for patriots, Honourable Speaker.
The bell ends the question period.